right, so it may be a little difficult to see, but yes, as Jeff would have said, my topic is bridging modern medicine and the traditional healing practices of IFA. Because we want to head towards an integrative model of holistic healthcare in our contemporary society. So, because of the lifestyle that I chose, I have a very interesting perspective where some of my time is spent practicing modern medicine, and then another part of my time is involved in experiencing IFA, the tradition, and the healing components of IFA. So I decided to dig a little deep to see if there's a way that we can bridge the two. So why does this conversation matter? Well, whether modern medical practitioners agree with it or not, many persons, and not just in Trinidad and Tobago, but globally, many persons will seek both medical and spiritual forms of healing, or they may go directly to spiritual forms of healing. What is important to note is that many illnesses are not just physical, they have different components. So there's a spiritual component, there's a psychological, social, and many other dimensions to illness, and it's not just physical. But there is a cultural disconnect between the healthcare system and the general public, particularly people who are spiritually inclined, and that creates some stress, some trust issues. However, in 2025, the World Health Organization actually acknowledged the importance for traditional, complementary, and integrative medicine as part of healthcare in general. What is IFA? I don't think that I am the expert on IFA, but I will highlight some of the points here because there are many IFA experts in this room. Right, so IFA is a philosophical and spiritual system. In literature, it has been described as a very comprehensive framework to understand life, destiny, and the human experience in general. It's also regarded as a pathway to healing and harmony by using divination, rituals, and other spiritual tools. And it connects all realms. So it creates harmony between the individual and the spiritual realm. So in my research, I found some core concepts that ties IFA to the healing process. So Ori, of course, has to be involved. So alignment or misalignment with your destiny can dictate how your health is. Iwa Pele. Now, I'll touched on Iwa Pele as well as Baba, because character, good character, can actually form part of medicine. Ebo, this is corrective action as well as accountability. So we are involving ourselves in the healing process. And Ashe as that force of transformation or the vital life force. So with modern medicine, most diseases are looked at under what we call the biomedical model. So it really just narrows it down to this problem with this organ creates this disease, and it's treated by doing 1, 2, 3, 4. But it does have its strengths because it brings diagnostic precision, the ability to learn to do procedures, infectious disease control, as well as emergency and urgent care. But the limitations are that many persons feel reduced to just a diagnosis or a number in clinic waiting to get called, and there's insufficient attention to the other aspects of what an illness truly is. So while people may get cured of their their medical condition, they would feel like they are still suffering. And it tends to be a very automated process. You pass in, you get you out as quick as possible. Right, so here are some areas for potential integration that I found. So cultural competence, and this is on the part of medical practitioners. Cultural competence, or I would also say cultural literacy, is very important, because if we don't understand the cultural background for our patients, then we may not really understand how the illness is affecting them. So herbal medicine and Baba will sign. Well, I think we all know the benefits there of understanding or having knowledge of herbs. However, there are risks with using herbal medication in conjunction with modern medicine or pharmaceuticals, because sometimes they may interact, and the challenge is getting each side to understand the other and work alongside each other to make sure that it remains a safe process. And rituals are also another part of integrating the both sides of the fence, because it would provide the traditional healing practices that they provide an emotional release, or a form of outlet for the emotional aspect of sickness. Right? It will provide a symbolic form of healing and creates a sense of hope, and it brings structure. So as with any thing with medicine, there is an ethical component to it. Now, if we are to integrate traditional healing with modern medicine, it cannot delay particularly emergency care. So there are some things that the medical doctor needs to address urgently. We can't decide that we're going to delay certain things to try herbs. And I want to say that cautiously. Right? I also want to say this one cautiously. There is the risk for exploitation. Now, this is not just on the traditional side, because in any dynamic where one person is in authority and the other person is vulnerable, there is the risk for the vulnerable person to be exploited. So there needs to be accountability and ethical frameworks to safeguard against that. And there are scientific limitations with traditional healing and herbal medicine. I'll also say that a little cautiously, but there are some limitations. So a lot of research needs to be done, because some of the herbal remedies do in fact work. But we need to understand how to prepare them, what the actual dosage might be, how they may interact, so that we can confidently use them. And we won't be guessing too much. And we also need to be honest about what we know and what we don't know. So, interestingly, there are some examples globally on the integration of these two sides of the healing fence. So in India, there's a model to treat psychiatric patients called the Dava Dua model. And that actually loosely translates to medicine and prayer. So the doctors will take care of writing the prescriptions to give the medication, but then they facilitate passing the patient on to get their spiritual guidance and spiritual healing. And research has actually shown that the patient outcomes have improved significantly with this approach, as opposed to just medicine alone. Now, in Cuba, their healthcare system is very different to ours. So from training come all the way up to practice, they have an integrated approach. So they learn the pharmaceutical side, and they also learn the modern medicine side. And it goes into practice where they actually have what they call green pharmacies. So these are well-regulated pharmacies that only have herbal medication, and medical doctors will write the prescriptions for those. And I would add that in many parameters that we use to measure the quality of health, Cuba actually stands out even with much better parameters than even first world countries. So their approach is clearly working. Right? And as I mentioned before, the WHO actually started showing support in their policies for these type of frameworks. So this is the framework that I am proposing that we can have some dialogue on, where we allow healing to occur across many dimensions, not just the physical. And the rejection of science by tradition is a disciplined meeting of both, where modern medicine protects the body, and sacred tradition, or the sacred Ifa tradition, restores meaning, alignment, and spiritual order. So thank you.